Good morning, afternoon, and evening to everyone. This is the video presentation for SGDB5 student project entitled Risk Factors Association to Coronary Artery Disease. These are the names of SGDB5 members. This is the scenario task for us. Allow me to read the scenario. Some patients with coronary artery disease have no well-known risk factors of this disease, but are diagnosed with cardiovascular events. Atherosclerosis is one of the major causes of death worldwide. Knowledge of the risk factors of atherosclerosis play a significant role in prevention and treatment of this disease. Recently, in addition to the known risk factors, other new risk factors including apolipoprotein A1 and apolipoprotein B have been proposed for this disease. In clinical conditions, high-density lipoprotein cholesterol and ApoA1 have anti-atherogenic effect. We want to find the best evidence about risk factor association to the severity of CAD and determine whether these parameters are better predictor of ischemic heart disease. My name is Karina with studio number 2002511003, and I will explain the background for this student project. Coronary artery disease occurs when myocardium does not receive enough blood or oxygen as a result of coronary artery blockage caused by atherosclerotic plaque. This plaque happens when the intima layer of the artery ruptured or damaged, causing macrophage to absorb low-density lipoprotein and creating foam cells. Over time, if the endothelium is not harmed further, this plaque may enlarge and stabilize. This lesion or plaque may increase the lumen even further, causing angina symptoms when there is not enough blood flow to the myocardial tissues. Certain plaques have the potential to burst, ultimately causing acute coronary syndrome for the subtotal or total obstruction of the lumen from the thrombosis. There are modifiable and non-modifiable risk factors for CAD. Even though modifiable factors are accounted for most of the prognostic performance, controlling the modifiable risk factors significantly reduces CAD occurrence. Specifically to the scenario we're about to discuss, hyperlipidemia and raised cholesterol levels are examples of modifiable risk factors, contributing to over than 2 million deaths worldwide. However, the connection between high triglycerides and CAD is much more complex because of other risk factors that have to be taken account. Thus, it is difficult to identify the specific role of triglycerides in CAD. The main structural proteins or lipoprotein particles, known as apolipoproteins or APOs, are responsible for directing the transportation of lipids and interacting with particular receptors to promote lipid uptake and deposition into tissue. Apolipoprotein A1 or ApoA1 is responsible for high-density lipoprotein and the main recipient of cholesterol when HDL transport cholesterol from the tissues to the liver to be discharged from the body. Apolipoprotein B or ApoB is the primary component of very low-density lipoprotein, and lipoprotein A. Thus far, a number of clinical trials and studies have indicated that the ApoA1 and ApoB ratio, low ApoA1 and high ApoB concentration may become an indicator of one's chance of experiencing coronary vascular disease. Problem formulations that are to be discussed include identify what type of questions of the above scenario, build up a clinical research question using PICO, formulate a clinical research question from the scenario above, search the best evidence or journal to answer the clinical research question, apply the critical appraisal to the journal, critically appraise to the evidence or journal that we find from our search, and apply the evidence to integrate the result with clinical expertise and patient values. The objective of writing the student project is to build up and formulate clinical research questions of the risk factors regarding the selected research that has been carried out in the purpose of being able to appraise evidence findings from the journal, risk factors of the disease and their association to the severity of the disease, and whether the parameters being appraised are better predictor for the disease. The benefit of the student project includes knowledge of risk factors and the potential marker to predict adverse effect of the disease, being able to conduct and formulate research questions, and developing evidence-based application based on clinical expertise and patient values. That is all from me. Thank you.
Hello everyone, my name is Cassandra with my last three name digits 152, and I will discuss about the question 2.1, that is identify what type of question of the above scenario. So the scenario above described involves a research or clinical question related to the association of certain risk factors with the severity of coronary artery disease or CAD, and the predictive value of these parameters for IHD or ischemic heart disease. Specifically, The question revolves around identifying the best evidence regarding the association of risk factors such as APO, lipoprotein A1, APO, lipoprotein B, high-density lipoprotein cholesterol or HDLC, and APO-A1 with the severity of CAD, and determining whether these parameters are better predictors of IHD. This type of question falls under the category of an etiological or causal question, as it seeks to understand the relationship between certain factors, that is the risk factors, and the severity of CAD and IHD consequently. So in the PICO framework, this scenario fits the P or patient problem population type of question. That's all from me. The next part will be continued by my friend. Thank you.
My name is Loputri Widyamritadewi with last disease number 002. I will continue the presentations. So this is a table of PICO of the journal. So the P is for populations. In this question term is patient with coronary artery disease, or the synonym, it can be patients diagnosed with coronary artery disease. For the I, for indicator is R, high level of apolipoprotein A1 and high level of apolipoprotein B. For the C, or comparator, are normal level of apolipoprotein A1 and normal level of apolipoprotein B. For the O, for the outcome, are the associations and predictive value of these parameters in the severity of coronary artery disease and also the incidence of ischemic heart disease. That's all from me. Thank you.
Hello everyone, my name is Juven Vianto, with last student ID number is 091. I will continue about the clinical research question. So there's two clinical research questions from our discussion. The first one is, in patient with CAD, are high apolipoprotein B compared to level of ApoA1 lipoprotein at higher risk of CAD progression and severity? And the next one, in patient with CAD, are apolipoprotein A1 and apolipoprotein B compared to HDLC a better predictor of CAD progression and severity? Thank you. Next.
Hello, my name is Madi Kirana Chandra Putri with last two digit of my student number is 168. So after we researched for the journals, we found a journal, a title comparison of apolipoprotein BA1 ratio, Framingham risk score, and TC-HDLC for predicting clinical outcomes in patients undergoing percutaneous coronary interventions by Mintian et al. So using this journal, we can answer the clinical research questions that we made before. So the first questions is, in patients with CAD, are high apolipoprotein B compared to level of apolipoprotein A1 at higher risk of CAD progressions and severity? So the current study looked at the possibility that vascular lesions and the severity of coronary artery disease were related to the ApoB-A1 ratio. The study discovered a substantial correlation between steadily rising cancer scores and ApoB-A1 ratios. The research population experienced 86 deaths and 161 adverse events throughout the follow-up period, including 17 unstable angina, 32 myocardial infarctions, 20 heart failures, 16 strokes, and also 47 cardiac deaths. According to the prospective cohort study, patients with greater ApoB-ApoA1 ratio were the ones who were more likely to experience cardiovascular adverse events and multi-branch lesions in the future. Next. For the second questions, in patients with CAD, are apolipoprotein A1 and apolipoprotein B compared to HDLC are better predictor of CAD progressions and severity? So high ApoB concentrations, low ApoA1 concentrations, and the ApoB-A1 ratio may be more indicative of the risk of coronary vascular disease than LDLC, HDLC, and LDLC-HDLC ratio, according to several epidemiological studies and clinical trials. The ApoB-A1 ratio has also been found to be useful predictors of cardiovascular events. The elevated ApoB-A1 ratio was found to be a stronger predictor of major cardiovascular outcomes in patients with established coronary heart disease than other traditional cardiovascular risk factors, such as smoking, history of hypertension and diabetes mellitus,
abdominal obesity, psychosocial factors, and also dietary patterns. These studies, along with the head-to-head study, also demonstrated that the ApoB-A1 ratio had the strongest relationship among serum lipid parameters with these cardiovascular outcomes. That's all from me. Thank you. Next.
Hello, my name is Margaret Community number 216, and I will explain about with our appraisal. The first question is, what's the define the representative sample patients assembled common or usually early in members of their disease? In this paper, yes, patients were selected as samples using appropriate inclusion and exclusion criteria. All subjects enrolled at the time of receiving treatment used as inclusion criteria. Second, was patient follow-up sufficiently long and complete? In this paper, yes, follow-up was done years after baseline measured. Third one, were outcome criteria either objective or applied in blind distribution? In this paper, yes, the primary outcome is the opposite of all aspects of myocardial infarction, discharge, revascularization, or example angina, all of which is objectively measurable. If subgroups with different factors are identified, then diagnostic factors take place. In this paper, yes, proper reporting for the number of factors has been done in analysis. Other compounding factors such as age, gender, and multiple factors were adjusted via multivariate analysis. Thank you.
Hello everyone, my name is Kylie with the last 3-digit numbers 114, and today I'm gonna explain about the journal appraisal, how good it is and what it means. So from what we read, we found that the research questions is relevant and addresses the comparative predictive power of the apolipoprotein B per A1 ratio against established markers. Then the study employs multivariate analysis and includes a 5-year follow-up, enhancing the robustness of the findings. And then the research has an extensive background covering apolipoprotein's function in lipid transport and its importance in cholesterol metabolism in detail in the introduction. It provides context for the research, and it also has well-defined goals, whereas during a 5-year follow-up, the studies clearly stated goals center on investigating relationships between the ApoB per A1 ratio and atherosclerotic risk factors, the severity of CHD, and cardiovascular adverse events. That's all from me. Thank you.
Good afternoon. My name is Justin Mordialin. My last 3-digit number is 431. I'm going to continue our presentation about the journal appraisal, how good it is, and what it means. The meta section also includes details on measurements, follow-up protocols, participant selection, and CHD diagnostic criteria. The approach gains credibility when well-known scoring systems like GenCNIC scores are employed. The research uses a longitudinal design in which the ApoB-A1 ratio is investigated as a long-term predictor of cardiovascular adverse events by incorporating a 5-year follow-up period into a prospective code study design. The article presents a well-structured study investigating the ApoB ApoA1 ratios association with cardiovascular risk factors in the Han Chinese population. The methods are generally robust and the results are clearly communicated. The discussion and conclusion could benefit from a more in-depth exploration of potential limitations and practical implications. However, the study contributes valuable insights into the predictive power of ApoB-ApoA1 ratio in specific population.
Hello, my name is Kari Maksmadevi with student A number 20025111189. I will continue the presentation about apply the evidence, integrate the result with clinical expertise and patient value. ABMP is a practice of medicine that integrates patient value and preference with research result and best clinical expertise available. In the journal that reviewed by our group, the results show that there was a significant association between ApoB and ApoA1 ratio and coronary heart disease severity. Compared with the Framingham risk score NTC HDLC, the ApoB and ApoA1 ratio had better predictive accuracy for disease outcome. Therefore, an increase in ApoB and ApoA1 ratio can predict cardiovascular disease. But to be applied as a reference for patient management, the characteristic of the study sample must also be accordance with the characteristic of our patients. In the research reviewed in this paper, the research result can be applied to elderly patients. That's all from me. The next will be explained by my friends. Thank you.
Hello everyone, my name is Emery. I'm going to continue for my friend Yuma. My last digit is 081. And to determine the APO-A1 ratio measurement that can be carried out on patient is taking a finished blood sample. The value of APO-A1 and APO-B can be assessed via immunoassay, but this examination is expensive, takes a long time, and its accuracy can vary. APO-B is known to be main source of the high predictive power of the APO-B or APO-A1 ratio. Alternatively, APO-B in circulating blood is often estimated using algorithms that are approximate values based on lipid variables such as total cholesterol, HDL, LDL, and triglycerides. Referring to the patient value, if the patient can afford the cost of the examination, APO-B and APO-1 measurements can be carried out. If a patient is found to have an increase in APO-B or APA ratio, therapy can be given that targets reducing the patient's APO-B. Several therapies then can be an option for reducing APO-B levels, such as statins, anacetrapib, niacin, and others. However, if the patient cannot afford the examination price, alternative efforts can be made. LDL-C is often used as a surrogate risk marker in clinical trials. Based on ASCVD risk calculated score, high or low, intensity statins are recommended for the targeting LDL-C. Atorvastatin and simvastatin have the best efficacy compared to other statin drugs. In Indonesia, simvastatin is a class of medicine provided by the BPJS or by the government, so it is easy to obtain and affordable for patients. That is all from me. Thank you.
Hello everyone, my name is Ketut Adelia Febranti Puspadewi with the last digit of my student ID number is 041. So I would like to continue the presentation with the last chapter, which is the conclusion. The coronary artery disease results from the insufficient blood supply to the heart and is a leading cause of global mortality. The hallmark of this disease is atherosclerotic plaque development, and the new risk factors such as apolipoprotein A1 and B are being explored. The study, which entitled Comparison of apolipoprotein B over A1 ratio, Framingham risk score, and TC over HDLC for predicting clinical outcomes, highlight a significant relationship between ApoB over ApoA1 ratio with coronary artery disease severity, and also, in addition, superior predictive accuracy. Applying evidence-based medicine practice, critical appraisal using VIA, which is validity, importance, and applicability, validates the research for clinical decision-making. ApoB over ApoA1 ratio assessment from venous blood, immunoassay, or lipid variable-based algorithm aids in predicting cardiovascular risk. The simvastatin emerged as an affordable therapy for increased ApoB over ApoA1 ratios in Indonesian coronary heart disease patients. And here are our references that we used for making this student project. Okay, that's all from our presentation. I would like to apologize if there's a mistake during our student project. And thank you for your time and attention.